In a world where hypnosis marketers have gone crazy, one man is here to deliver a knockout, bone-crushing blow and strip away all of the marketing hype and bull. And now you're in on the best-kept secret in the field. You're listening to the Hypnosis Product Reviews Podcast, leaving only cold hard facts, point blank. No questions asked. Subscribe to the newsletter to get 12 training products absolutely free from the world's top trainers, such as Stephen Brooks, Jonathan Chase, Igor Ledochowski, Jeffrey Stevens, Daniel Jones, Richard Nongard, John Overderf, The Head Hackers, Anthony Jacquin, and much more.
Aloha, it's Antonio with HypnosisProductReviews.com. For this Hypnosis podcast, I'm interviewing Adrian Madrill from ComplimentAryCareHypnosis.com. How you doing today, Adrian?
I'm doing absolutely wonderful, thank you.
Now, can you give my audience a brief background about how you got into hypnosis?
Well, it was kind of not a direct line by anything. Really what happened was my wife is a family physician in southeast Kansas, and with the way that healthcare is going, I sometimes hear her come home and wish that she could do more for her clients or her patients, and weight management's one of the things that she has talked about. And when she was in residency program, I remember the discussion going on that hypnosis was one of the most effective ways to stop smoking and to lose weight. And so I thought, well, let's take a look at this. And that's basically how I got the interest into it.
Yeah, it's hypnosis. Obviously, I would say probably 99.9% of people listening to this podcast know how effective hypnosis is to lose weight, quit smoking, get over anxiety, all kinds of other issues. The thing that I'm really interested in is your upcoming talk at Hypno Thoughts Live. And for everybody listening, Hypno Thoughts Live is going to be the first ever live hypnosis conference put on by hypnothoughts.com. And if you're not a member at Hypno Thoughts, if you're listening to this podcast on my website, if you look either above or below this video, I'll have a link to Hypno Thoughts and the upcoming conference. The conference, what are the dates again? Is it 14th, 15th, and 16th of June?
That's the dates of the conference. There's also pre-conference and post-conference classes that are going on. And my class is actually going to be on the 16th at 9 o'clock in the morning for all you early birds.
That's definitely not me. I'm not one of those early birds. I'll do my best to attend your class.
Oh, I appreciate that. I got some pretty good competition. Roy Hunter's going to be in the classroom next to me, and, well, if I wasn't in my room, I'd probably be in his.
Oh, you shouldn't have told me that. Now I've got a little parts dilemma going on inside. Got that little parts conflict. Now, what's your talk going to be about?
Well, my talk's going to be how to effectively communicate with primary care providers, your family physicians, your pediatricians, your nurse practitioners, your physician's assistants, basically the front line of the medical community with their patients. Basically should be our bread and butter for our clients.
Oh, definitely. And I've talked to some practitioners of NLP, hypnosis, hypnotherapy, EFT, whatever the modality is. And a lot of people, they have this mindset that we're better than the practitioners, or the general health practitioners. You never want to come across with that mindset, because they know what they know. They've gone to school for it. They put a lot of time and effort into learning certain skills that can help their clients. We're just there as a kind of, like a complimentary kind of deal.
Exactly. And that's why I named my practice Complementary Care. I don't want to have any misconception with alternative care. This is not something that I encourage my clients to do without their physicians. I highly encourage that communication between their primary care provider and my office.
And now, if you don't mind me asking, can you give my audience a couple of the Just some general advice on how to do what it is that you've learned to do, I guess without revealing too much of what you're going to be talking about at the conference.
Well, probably the biggest thing that I found is been a block for people dealing with the medical community is basically the misconceptions that they already have. When I first started in hypnosis, there were the circle that I first knew. They were of the mindset that the medical community here does not want to work with us. And then in some of the first classes I took, it was, oh, well, like you were saying, that sometimes we feel that we're better than the Western medicine in the way that we approach things and get things done. And a lot of what we need to remember is basically what we know as a pre-talk for our clients is really all the tools that we need to effectively communicate with the medical community. You know, we need to first break our own misconceptions. We need to be able to listen empathetically to what the physician's needs, what the medical community's needs are, and we need to come in as more of a kind of a supportive role in things, and not the, oh, I can do this better than you, like you alluded to earlier.
Yeah, if you come across and you try telling somebody who's a expert in their area, if you try having this attitude of I know more than you know, they're never going to refer a client to you. That's just how it's going to happen.
I agree, and in fact, one of the little nuggets of information that I have to share at the Hip Thoughts conference is I kind of, as a role of physician spouse, I went on the annual conference for my wife in 2012, and I was rather bored, so I just took a pen and paper and started walking around and started asking doctors, if they would mind answering a few questions for me so that I have information for my next conference. And the questions I asked were, if a provider was new in your area and wanted to get information to you about the services they performed, what would be the best way about it? Because myself, knowing that the things that I've heard on some of the other hypno professionals training packets out there, they talk about waiting in line like a drug rep, or they talk about sending in your business card with a brief letter. They talk about different things, and I know that may have worked well for them, but it doesn't work well in every situation. And so what I asked that question to find out what works best for most people, and what I found out is that you really don't have one way that works well for everybody, because their standard, the way that their practice is set up may not be readily available to accept you in the same way as somebody else's practice was or is. So if you take somebody who's in a private practice, they, like my wife, for instance, a rural family doc, she gets up in the morning, has to round at the hospital, she has procedures in the morning, then she goes into her morning clients or her morning patients practice. She might get interrupted with a baby that needs to be delivered, or somebody who's so sick they have to ship out to a tertiary hospital. So then her morning is thrown off. She works through lunch, and then her afternoon continues to run late, and then after that she's working on charts or has to go around at the hospital some more. So the stand around like a drug rep only really interferes with their day, or the going in and being a part of their noon conference doesn't really apply in that sort of practice. And so the different types of setups that you have, you just need to be aware of what is going to be more, what's going to work better for their schedules and what they have as a opportunity to listen to you present your information.
That makes total sense. I've actually heard some people recently talking about almost modeling what I'm sorry, what some of the drug reps do to actually get your foot first in the door talking to the health practitioner.
I see that logic. I see that model. It's what the doctors know. But if you ever sit in the doctor's office in the waiting area and you wait to see these drug reps stand there in the corner, they have their tablet that the doctor has to sign off on, and they may have 15 seconds to say, this is the latest thing that our company is doing as far as research. This should be on the market soon, or this is the latest thing on the market, and this is how it'll help your patients. Sign here, please. And that's what they have. Now try to imagine doing your pre-talk in that amount of time, or answering questions, or sharing with that physician what your ideas of hypnotherapy is. It just isn't reasonable. What I think that model is excellent for is if you've taken on additional training since the last time you talked to that primary care provider, and you update them that, here, I just want to let you know I came back from an additional class for specializing in pain control techniques. And if you have any clients or any patients who you think would benefit from learning some new techniques to help manage their pain, feel free to come my way, or I'd be happy to meet with them in your office.
Yeah, that does seem like a pretty good idea. I think the whole thing is about creating a kind of relationship. And you basically, from everything that I've heard from people that are really effective at working with doctors, I believe Richard Nongard said this. It might have been Richard Nongard or Craig Eubanks, so I think it was Richard Nongard talking about how you want to make sure that you're not going to take their patients away, that you don't know what they know, that you're just, like I mentioned before, you just want to help complement their service. And if you can help some of their clients, let's say if they have a client, a lot of doctors will tell their patient, be like, you know what, you're too overweight, they're going to have to amputate your foot, you're going to have to quit smoking, do whatever. A lot of them, they don't know how to actually help their clients doing that. They know what's going to happen if they don't do it. They just don't know how to get their patients to that level.
That's true, and it's quite interesting when you have a relationship with a doctor and you can actually talk with them on a professional level. When I first started doing this, not all the doctors were immediately receptive. Some of them had read certain studies that said it was only effective as far as relaxation techniques go and that sort of thing. And I find that if you take the time to actually become an expert in your field, become an expert in what they're thinking. I had one of my first clients came to me for weight management. She also had fibromyalgia, so I took Melissa Roth's fibromyalgia course. And in doing that, I had a lot of knowledge that in fibromyalgia that some of the physicians were coming to me and say, well, okay, Adrian, tell me what the latest thing is with fibromyalgia that you're learning on your side of things. And I would give them a little bit of information and they would be surprised. Or I had a smoker who quoted a study that I must have read on one of the smoker blogs or something about how nicotine can help offset the progression of
Parkinson's.
Parkinson's, yes, and
I knew
other
I knew what you were going to say. Yeah.
neurodegenerative diseases is the word I was looking for. And so I was surprised that how quickly people of certain, I hate to say it, but certain diagnoses, they know the latest information sooner than the doctor does. But you're dealing with a primary care provider who has to know the whole body, who has to know so much more information that they may not always know the latest study out there, or how their patient's going to misinterpret the reading on that.
Yeah, it's pretty interesting. Like me personally, I don't really have. So I'm actually working on starting my private practice now. I don't have too much experience working with doctors. I do have one doctor that I gave some business cards to. I haven't really noticed a I haven't got any clients from that. I think one reason I need to update my website. The other thing is this doctor is pretty well known for, a lot of doctors are well known for passing out narcotics because they obviously get a kickback, so he's obviously never going to give me any of his pain patients. Weight loss patients, yeah. Weight management patients, but pain management, that's definitely not going to happen with this guy.
Well, how do I put it? My wife sounds like it's like she's the opposite of this particular physician. My wife is one of those that is not going to give you a pain medication just because you want a pain medication. She makes sure that you have a need for that pain medication. Just like someone who comes in and the first time that their nose starts to run a little bit and they want an antibiotic. Well, good medicine says, well, if it's not an infection, an antibiotic's not going to do you any good. A virus is not going to be affected by the antibiotic. So she's kind of more of that, not necessarily appease the patient, but do what is best practices of medicine, if you will,
for the patient.
For the patient, yes. And with that, I kind of agree with Richard Nongard on techniques that we use when we're talking to physicians. Now, don't get me wrong here, but when we're talking to physicians, talk about techniques or talk about strategies that maybe go along the lines of what they might understand better. If you throw words out like regression, and I'm not telling people not to use regression in their practice. I use regression in my practice when the client's subconscious dictates. But if you use a word like regression in the medical community, well, it means to go backwards. And when they talk about regressing, they're talking about the patient going backwards in the improvement of their health. And so certain terminology is going to set you back as well as some of the techniques that you use. If I talk about regression with people, I don't remember who I got this from, but I talk about it more as an idea of ghost of Christmas present, ghost of Christmas past type of thing, and then it's not as scary to people who aren't familiar with regression.
Yeah, okay, that does make sense. Yeah, I have heard Richard talk about how you want to know, maybe you want to study some of the lingo that doctors use and try to speak to them in their language.
That was a recent discussion on Hypnothoughts, actually, or sub-discussion, or who knows. I think it was on one of my discussions recently. It kind of was sidetracked from there. But it doesn't hurt to be able to talk on the language of the primary care provider. As part of my talk at Hypnothoughts Live is that you travel abroad, and it helps if you take a translation dictionary with you. If you make an effort to speak the language wherever you go, say you're going to Spain and you're trying to talk a little bit of Spanish. Most communities that I've traveled abroad to, they really appreciate you making an effort to speak in their language. Even if they speak English, they'll let you off the hook then and say that's okay, and talk to you in English.
Yeah,
so
they may let you go on for a little while, and then they're like, hey, don't worry, we're messing with you.
Right. So the idea is it's appreciative if you're able to talk that language. But not only that, but if you have that idea of going in there and talking your own language to a physician, you're walking in on their territory, you're walking in on their time. Their time is so precious. Not that ours isn't, but every second that we take is an opportunity then for them to either see a client make money or finish paperwork and get home to see their kids before they go to bed. So if we make them have to work harder to come to us on their territory, they're not going to be as receptive to it. But if we go in and we talk a little bit in a language that they might know. So when we're talking about say smoking, and they want to say, well, Adrian, how effective are you with smokers, or how effective is hypnosis with smokers? I tell them, well, you know what? Whatever I tell you right now is going to be anecdotal evidence, and typically that's not the way that you learn Western medicine. But because the way that hypnosis is, I have to tailor it, or it's best if I tailor it to each person individually. It makes it difficult for me to have a set study like you'd be used to. But telling you that, I can tell you that if you look at the effective rates of your NRTs, your nicotine replacement therapies, you'll find that your gum is this percent, and your patch is this percent, and go through the different ideas with them. It starts to make them, like in sales, yes, I agree with you. Yes, I know this information. And then you throw out there, and my rates are this percent. They're already accepting of that idea that makes it sense to them. It comes in a language that they understand. It comes in a model that they understand. They're more willing to accept it than to think that you're just some sort of woo-woo hypnotist out there looking for free referrals.
Something you brought up, which I think this is kind of outside of the scope of this podcast and the talk you're giving, is about sales. A lot of hypnotists should study sales. I don't care what anybody says, and I don't care what people think about sales, if they think it's evil or whatever. Study sales, because if you want to be a successful hypnotist, you have to know how to sell yourself. Bottom line, that's the truth right there, and I'm sure you would probably agree.
I agree with you completely, and not just hypnotists, but that's what we are. And I do think that it actually still ties to this. When you're wanting somebody to buy into what you're doing, you have to sell them on that idea. Like I was talking to you before the podcast, when I was a police officer, if I needed to remove somebody from their residence, I had to sell them on the idea that this was the best thing for them, maybe even present it in a way that they come up with that idea. And if we do that with everything, if we do that with our spouse at home, we do that with the physicians that we want to approach, we present it in a manner that, from a sales perspective, then we have a much better chance of being effective. When we go into it with with my 100 hours of education or 150 hours of education, I know more than you with your 4 or more years of education, 4 years of medical school. If they did a combined MD, PhD degree, tack on another 2, 3, 4 years on top of that, then throw on a minimum of 4 years of residency. If they subspecialized, add more time onto that. We really come off really smug if we come off thinking we can do your job better than you can. But if we take an approach that the physicians would already know, and that's one of more of a teamwork approach, a adjunct, that hypnosis is an adjunct to what they're already doing with their clients, then the doctors are more accepting of that. You're not taking, like you were saying, you're not taking your client or their patient away from them. You're just helping them with their patient in an area that they may not have the training, and that area might be on the emotional side of things or the stress side of things.
Oh yeah, that's I'm sure we've probably all had friends that like to be smart. They like to be the know-it-all, and anytime somebody does that, it just gives you the kind of irks you the wrong way. It gives you a wrong kind of vibe. And if you're doing that, trying to get especially in a small community, if you're going up to the doctors and you're acting like that, I guarantee you a lot of those doctors see each other all over the community. They're going to be like, hey, this guy came up to me. Don't bother. If he wants to talk to you, don't bother talking to him or her, and they can you shoot yourself in the foot.
Well, and you raised a good point there. I mean, anything you do that would be negative towards that doctor. I don't know how many hypnotists that I've talked to that feel that they can self-medicate better than what their physician can, and so I'm going to grow my herbs and that sort of thing. And again, if you do that, that's fine. Not going to medicate yourself, but don't come off with the attitude with your now new client that, oh, well, yeah, don't take that medicine. That doctor doesn't know what they're doing. They're just poisoning you. What you really want to do is this or that or something else. And that's really not the role of, of a team player. And that's the approach that we need to have, is a team player approach with the medical community. One of the other doctors that I talked to at the scientific assembly, which was, the American Academy of Family Physicians annual conference, said, whatever you do, you just don't make me look like a fool. And what he was saying is just basically what we just went over. If he's going to send you a patient of his to be a client, don't make everything that he's done for that client already, our client, his patient already, make it look like it was just a waste of money, a waste of time, because that is just a slap in his face. It may not have been
definitely.
It may not have been the right answer, or it may have been enough of a right answer to where what you were able to do now is effective. Combination therapies are so much more effective than a single therapy alone. And that's another way you can approach it with family medicine or any primary care provider.
Yeah, don't act like one of those people that takes a weekend training course and then you think, like, oh my God, I know everything. It's called continuing education. Exactly.
What I try to tell new hypnotists is, if I had to do it all over again, I would come into the clinic and approach the physicians from a perspective of, let me help with stress management and sleep improvement, because we know how effective we can be with that so easily. Most people just come and sit in my chair and already start to experience that effect when they're walking away from their stressor. Two, they're taking time to breathe, probably for the first time that day. There's just so many ways, and all I have to do is just say, there, that's right. Just, relax.
Exactly.
And they do it. And so it's probably the easiest way for us to get our foot in the door. I think there's studies that show anywhere from like 80 to 85% of the reason why someone would go to see a primary care provider is stress related. It's either induced by stress or it's exacerbated by stress, which means it makes it worse. So if we can help them with their clients to reduce their stress, don't come in saying, I can cure fibromyalgia or I can cure IBS. Come in and say, well, these things are directly related to stress. It may not be the cause of it, but it does make it worse for them when they're under more stress. Their symptoms tend to be more exacerbated. This is one way that we can help your clients with your patients with the way to teach them little techniques to help control the stress, help them regain a little bit of quality of life, even though they have their diagnoses.
Yeah, and I remember recently, I don't know if I had posted something on HypnoThoughts. There was a hypnotist that was on a Facebook page. I'm going to leave the Facebook page unnamed. I think he was trying to use it as a way to get clients, but it just came across really bad, really condescending. I'm like, look, if you're coming across condescending, basically posting things that doctors don't know what they're talking about, you're gonna look like an a-hole. There's no way around it.
Well, not only that, but you make the rest of our community look that bad.
Oh yeah.
If say one of your listeners is going to be at HypnoThoughts Live and they're saying, well, I don't really want to work with the medical community because I think they're a bunch of idiots and all they do is try to prescribe all these things to you so they can get a lot of money. If for any other reason it's to come and look from a different perspective of really what we're dealing with, that may not necessarily be the case, but also that the importance, if we really truly want to build our profession as a respectable profession and have that little niche in the United States as an effective industry, then it's only beneficial if we all treat other professions on a professional level with professional courtesy. Even if you're a stage hypnotist, if you have a a negative outlook on some manner of well, like say with the medical community, and you rant and rave about it, it's going to hurt. It's going to give us all a black eye, not just stage hypnotists. I'm sure on the same part, if I went and said that, the entertainment industry were all idiots, then they would not like to have, the stage hypnotists come out and perform as often as we'd like for them to do that.
Exactly. When if you act like an idiot, and I'm not saying there's not idiots in any other field, there's idiots in every field, but if you act like an idiot, especially with a small community like hypnosis and NLP community, very tightly knit community, and if you act like an idiot, you do a good job of unraveling all the threads of the community.
I completely agree. I come from a background of living on a submarine, 130 guys in a 2-story Pringle can, if you will. We didn't really have all the wonderful benefits of being on, say, like an aircraft carrier that has 5,000 people. If you wanted your haircut, we didn't have a barber. You went down to one of the missile techs and he cut your hair. So everybody had a part to play, and the best way to have an effective crew is for everybody to have an understanding of somebody else's job, maybe not to be able to do their job, but to assist them in doing their job so they can assist you in doing your job. And I don't know if that came out as well as it did in my head, but really that's so important as far as being an effective hypnotist, trying to help the community get over certain issues that they have, whether it's stresses about IBS or emotional issues that lead them to eating or whatever the case may be.
Yeah, basically, be cool. Don't come across condescending in any matter of life, for that matter.
Exactly. Know your target audience, whether it's a client or whether it's your target audience is, how am I going to win over this physician? Make an attempt to speak the language. You're just more accepted easily as if you were traveling in another country. Just different things like that. If you come to my talk, I have a handout that I give that's the top 10 questions that physicians had when I asked them what would be the best way for me to come to you, what would be questions that you'd have of me if I came to you to tell you I was a hypnotist working in your area. And some bonus nuggets from some of the doctors that I talked to, like I was saying, you'd make me look stupid. Don't make the doctor look like an idiot. How do you make my life easier? Is a good one. And so some of these things are little helpful questions I'll hand out to you. If you think through these things, and you have a good answer, then it's not so much about looking for a free handout. Send me your patients because I think I can do a better job than you, or send me your patients because you've been ineffective in helping them with their problem. We don't want to come off as Scott Sandlin says, my lack of education is so much better than all the years of your education.
Hey, exactly. Yeah, that's a good one from Scott. So Scott, thank you. That was a good tidbit.
But yeah, come to my talk at HypnoThoughts Live. I got 10 questions from primary care providers from the 2012 American Academy of Family Physicians Scientific Assembly. Wow, that's a mouthful. And as well as some bonus tidbits, some language, how to present your anecdotal evidence to look more scientific, different things like that.
I can't wait. It's going to be a blast. So for everybody listening to this, if you're on my website, the podcast on hypnosisproductreviews.com, either above the video or below it, I'll have a link to Adrian's website, a link to HypnoThoughts and HypnoThoughts Live. Make sure you check everyone out. And the other thing, if you want to get 12 free trainings from the world's top experts, make sure to subscribe to the newsletter by using the form below. Put your email, click Give Me My Free Trainings, or in the upper right-hand corner. I always got to remember what corner, so I'm looking at the camera. I'm trying to get myself all situated.
And Antonio, for your audience, if they come to my website, I don't have any products to sell. I'm I'm not a instructor or anything like that. I don't look at making money off of anybody. But if they have a question about some ideas that they might be able to work with within their medical community, what's the best way to approach? If they give me the idea of what kind of environment they're in, I'll be more than happy to answer any questions for them. My contact information is on my website.
Sweet. And also on the lines of questions, you guys have any questions? There's a comment section below this video, below the podcast. Go there, fire off some questions. You can either use the Facebook comments form or the normal comments form. Fire off a question, and I'll make sure that Adrian gets it. Adrian, it's going to be a blast. That's only, 80 days away? It's super close.
76 or 74?
Oh, boy, I gotta start making some money fast so I can get over there.
Well, you get over there and first night's drinks on me. How's that sound?
Oh, boy, I'm not going to remember it. My liver's going to love you. Actually, my liver's probably going to hate you.
Well, I think we'll find a hypnotist for that.
I'm sure we will. Everybody listening, come out to the event, hypnothoughtslive.com. Check the videos below this link or above, and I look forward to seeing you there. We're going to have some unbelievable event. We're going to have a ton of street hypnotists, therapists. It's going to be incredible. I look forward to seeing everybody, and it was awesome talking to you, finally getting a chance to interview you, and I will see you soon.
We'll see you then.
Aloha, everyone.